welcome back to another lecture of Dental Pathshala, where we help you understand and learn dentistry better and easy when this is a express revision course for oral surgery. Before we get started, make sure to subscribe to the channel and hit on the bell icon so that you don't miss any of our exciting videos. You can also check out the link provided in the description box below for the notes of this particular video, or you can check out our website www.extrude.com for more interesting notes. Or if you are interested in watching more videos like this, you can check out the playlist of our channel. So let's get started with the today's topic, which is the distraction osteogenesis. Now, as the name suggests, distraction, what do we mean by the term distraction? Distraction means moving two things apart. So that is moving apart, and osteogenesis word means that bone formation. So basically it is a method of forming a new bone, not by a bone graft, but rather using the previous bone itself. So say suppose this is a bone we have and we want to increase the length of this bone. How do we do it? Or suppose we want to increase the width of this bone. How do we do it? We prepare a osteotomy, that means we cut this bone and then we start moving the bones. So we start moving these fragments. Say suppose I have prepared a cut in this bone. Now what do? I start moving this fragment of the bone. Now what happens when I start moving this bone? There is a new bone formation occurring at this end. So this is a new bone which is formed. So this is the distraction osteogenesis. That means as you can see up in the diagram over here, so we have put a distraction device which is going to move the bone fragment. So with the help of this device, we are going to move this part of the bone which we have fractured or which we have prepared in this direction. Therefore, we will have a new bone formation here. Once we start separating, distracting the bone fragment. So this is the distraction osteogenesis. Now there is no requirement for a bone graft or a rigid fixation of a bony fragment, since we can establish a new bone. There is a histogenesis occurring at the bone. Not only that means not only the bone is growing, there is bone as well as the surrounding soft tissues also which are growing. So there is no requirement for a bone graft or a donor site morbidity. We do not require another site to prepare in order to add a new bone, in order to regenerate a new bone. So we have certain steps in case of distraction osteogenesis. The first thing which we do is prepare a osteotomy. So as you can see up in the diagram over here, our main goal is to increase the width. So if we want to increase the width, of this particular area, to increase the width, we have prepared a osteotomy. So first step is preparation of osteotomy. Now as you can see up here, there is a osteotomy which is prepared at this end. Then what do we do is, we let this set for few certain time period. So that is called a latency time period. So this is osteotomy plus, you can see over here is the latent period. That means we are going to let the hematoma formation happen, let the callus formation happen, and then once the hematoma is formed, we start distracting the bone, we start separating the bone fragment. As you can see up here in the picture 2, this is the distraction. So we will be studying two things in distraction. One will be studying the rate, another one will be studying the rhythm. So then in the third picture over here, now we have distracted the bony fragments. That we do it slowly, in a rate, in some rhythm. Then we let this bone formation occur. So that period is known as consolidation, wherein there is no movement of the bone occurring. And then the last phase we have is the remodeling of the bone. So basically what we are doing is, we are separating the two bone fragments. So as you can see up over here, so this is an intraoral device. As you can see, this is an intraoral distraction device, guys. So this purpose of this distraction device is to separate the bone fragments, to distract the two bone fragments. So this is an intraoral distraction device. And you can see in this diagram we have the one which is extraoral. So we have prepared osteotomy here, and then we start distracting the fragments, bony fragments, and therefore there is a new bone formation which occur on each side of this osteotomy. So this is known as the distraction osteogenesis. Up here is a extraoral distraction device. So this is the main principle or the main goal of distraction osteogenesis, that is the formation of the new bone, so that there is no requirement of bone graft. So how do we achieve it? By gradually separating the two bone fragments. So we are gradually separating the bone fragment, and therefore we are inducing this bone formation. So how do we do it? First we prepare osteotomy, that is we make a cut in the bone. So and then we put a distractor device. So the purpose of this distractor device is going to separate the bone segments, but at a controlled rate. We cannot just separate it on our own wish. There is a rate to do that, so that there is a bone formation which occurs, and the principle is based on the tension theory. So basically it is given by Elizarov. We will be talking about the Elizarov principle. So the main purpose is that it is going to make the bone, create the bone formation, so that there is no requirement of a bone graft or there is no donor site morbidity. So the distraction osteogenesis is the bone formation, regeneration of the bone by gradually distracting the two fragments of the bone. So say suppose this is a bony fragment we have over here, and then what we do is we prepare a cut in this bone, we prepare a osteotomy site with the help of a burr. Say suppose I want to increase the length of this particular bone. So what I do is I prepare a osteotomy site, and then I start separating this bone. So once I start separating this particular fragment of the bone, there is a new bone formation occurring at this end. So gradually distracting the bone ends on each of the side of a corticotomy or osteotomy. See, the difference between corticotomy and the osteotomy is that corticotomy we do it for a long bone. In case we only cut the cortex, we spare the medulla. But in case of say in a maxillomandible bone, maxillomandibular area wherein the bone is more vascular, so we make a cut through and through. As you can see over here, I have made a cut through and through. That is why I am calling it the osteotomy. So either you are going the corticotomy or you are going for the osteotomy. Since we are dealing with the oral and maxillofacial tissue, so we prepare a osteotomy, then it is followed by, so the first step is going to be the osteotomy, right, and then we keep it in its place for certain time period, so that there is hematoma formation which occurs. So that is our latent period. Then we do, what we do is we apply a distractor device. So that device is going to separate the bone fragment at a controlled rate. So this particular stage is known as the distraction. That means placing a device like this, if you can see over here, placing a device and separating the two bone fragments. In that we will be studying two things. One is the rate at which we are separating the bone fragments, and the rhythm at which we are separating the bone fragments. Then we leave it in its position so that the bone formation in this particular space happens. So up till now we have prepared osteotomy. Now what we do is So we have prepared osteotomy. Let's make it again. So this is the osteotomy which we have prepared, guys. Right. So we are taking this particular fragment into this this direction. So there is a new bone formation which will occur at this end. So in this particular situation, we are going to put a distractor device. Say suppose this is a distraction device, right? This is just a diagrammatic representation, guys. So this is a distractor device, say we have put over here. Now the purpose of this device is to do the distraction of these bony fragments. Now we want this bone formation occur. So the fourth step is consolidation. Consolidation means we are keeping it as it is. So we are not doing any movement. No movement of the bone. So that the bone formation occurs, there is hard callus, and then there is a remodeling of the bone, and that is how the bone formation occurs with the help of distraction osteogenesis. So these are the Elizarov principles. So let's just write, these are the Elizarov principle. So what are the steps? First thing is we prepare a cut in the bone, that is we call the osteotomy. Then we let it sit so that new blood vessels are formed. So that is the latent period. Then we start distracting these bony fragments which we have cut. So that is known as the distraction. Then we keep it as it is in its position. We do not do any movement of the bone so that the new bone formation occur in between this area. So let me just make this so that the new bone formation occurs in this particular area. And then there is remodeling of the bone. So the steps are osteotomy, latency period, distraction, consolidation, and the remodeling. Now I am going to show you a custom made distraction device. How it looks. What are the components? See, if you want to increase the length for up to 15 millimeter, then we use this 15 millimeter device. If you want to use 20 millimeters, then we use the 20 millimeter device. If you want to lengthen up the bone up to 25 millimeters, then we use this device. So basically, this is the movement this device does. Now there is a screwdriver so that we can open up, we can do the movement of these bony fragments. So the first marking you can see is the sleeve for the distraction screw. So in this sleeve, we are going to put this distraction screw. As you can see, this screwdriver, we are going to put the screwdriver in the first position. So sleeve for the distraction screw. Then the second one you can see is the fixed block. So it has got 3 stainless steel holes for a bone plate which is fixed to the medial fragment with the help of the screws. So basically the second point you can see over here, which is our fixed block. Let's take the other color so that, so this is the fixed block. So if you can see, this fixed block is attached to number 6 and 6th one is a bone plate. So if you can see, this is a bone plate and it has got 3 holes in it. So this is a 3 holes bone plate. We usually use the stainless steel one. So this is a 3 hole stainless steel bone plate which is used for fixation of the distraction appliance. So this fixed block is attached to this number 6, which is our 3-hole bone plate, which is fixed to the medial fragment with the help of the screws. Then the third one you can see is our movable block. Now this block is going to move. So the third one is a movable block. This particular block, guys. This block is the one which is going to move. And the second one is the fixed one. So that remains fixed. So this block will do the movement of the bone, distraction of the bone. So this movable block also, can you see, it consists of a 3-hole stainless steel bone plate, which is a triangular bone plate. Now it is attached to the distal fragment. So along this block the bone is going to move. So this is a movable block along which the bone is going to move. So what do? We attach the screwdriver and then we start rotating the screwdriver to 360 degrees. So one turn of this screwdriver, one turn of 360 degrees, that means a full rotation. One turn, which is the 360 degrees full rotation, will give the distraction of 0.5 millimeters. So the threads of the pitch is basically 0.5 millimeters. So I can just write the pitch thread also is that is the reason that one full turn will give a 0.5 millimeter of the distraction. And see, if you whatever appliance you are attaching, based on that the movement will occur. So 15 millimeters will do the movement up till 15 millimeters, 25 one will do the distraction up till the 25 millimeters. So next one we have is, the third one is the movable block. Fourth one is this rod, as you can see, this central rod. So this is the fourth one. So fourth one is the rod, the central rod. So this central rod has got pitch and each pitch is 0.5 millimeters. So if you make a 360 degree turn, that will bring about the distraction of 0.5 millimeters, right. Then the fifth one are two guiding support rods, one above and one below. You can see one is above this central rod, one is below this central rod. So this is the central rod, right, the fourth one. Then the fifth one is a rod which is above the central rod, a rod which is below the central rod. So this is the fifth one, guys. So fifth is our guiding supporting rods. Guiding supporting rods. They are two in number, right? They are two in number. One is above, one is below. So their main purpose is they are making a parallelism with the central rod. Then the sixth one we have already covered, which is our bone plate. So this is a bone plate, 3-holed triangular one, which is used for the fixation of the distraction appliance. So used for the fixation of the appliance or the device, I can just write. So seventh one is the stabilizing plate holding the central rod and the guiding planes together. So as you can see up over here, this rod is basically holding the central rod also, holding these two parallel rod also, right. So these two. So seventh one is our stabilizing plate. Which is holding the central rod as well as it is holding the two guiding plates at the end, right. So this is basically present at the posterior end of this whole device, posterior end of the assembly. Now eighth one is our screwdriver, which fits into the slot of this distraction screw, and that is how the movement occurs with the help of this distraction device. So this is a distraction device which is going to separate the two bony fragments at a control rate, because we know that if we make one turn of this, then it is going to make the 0.5 millimeters. So this is a custom made, guys. So it is going to move 0.5 millimeters of the bone, going to separate or going to do the distraction up till the 0.5 millimeters. So first distraction osteogenesis was described by Cortevilla, but the father of the distraction osteogenesis is the Elizarov. So there is Elizarov principles, which is basically based on the stress tension principle. So what is the stress tension principle? It says that, say suppose these are the two bony mass or two bony fragments. After osteotomy we get two bony fragments, right? So it is telling that if we apply forces away to each other, that means if we are distracting the two bony fragments away from each other, there is a tensile force. This tensile force creates a tension and there is new bone formation which occurs. So this is, it works on the stress tension principle. This is very important, guys, for MCQ viewpoint or for exam viewpoint. So the Elizarov principle is based on the stress tension principle. What happens? There is tensile forces. These tensile forces are applied to distract the two bony fragments away from each other, and therefore it induces the stress, and this stress will lay down the new bone formation. So it is going to regenerate the new bone. That is the Elizarov principle. So where all situation are we going to use the distraction osteogenesis? Now we know that whenever we need bone, we are going to use the distraction osteogenesis. So we are not going for bone grafting. Instead of that, we are going for distraction osteogenesis because it stimulates the histogenesis. Not only the bone grows, in fact the surrounding soft tissues also grows. And if we are going for bone grafting, that means we have to take bone from another part of the body. Say suppose if you are taking costochondral graft, which we talked about in case of the Caban's protocol in the previous part of the lecture for the TMJ ankylosis. So if you remember, I told you the Caban's Caban protocol. Let me just show you, guys. If you remember the last video, I told you recently we use the distraction osteogenesis instead of the costochondral graft. So instead of taking putting one more incision at the chest, I mean below the chest, and then we take out the 5th or 7th rib, instead of that there is no requirement of a donor site. We use this distraction osteogenesis. So one indication is going to be TMJ ankylosis, which is the latest version of the Caban's protocol, the recent Caban's protocol. So one is the TMJ ankylosis. Another one is wherever we need bone, wherever we need to increase the height of the bone, width of the bone, or we need to reposition the bone. So all these situations we can use the distraction osteogenesis. Very simple. So micrognathia, micro means small, gnathia means jaw, when there is a small jaw, and the conditions which are associated with the small jaw. All these conditions we can use the distraction osteogenesis to build up the jaw. We can also use bone graft, but bone graft, one thing is that we cannot grow the bone to as much as height. We can grow using or regenerate using distraction osteogenesis. Another thing is there is no requirement for a donor site in case of distraction osteogenesis. So this is the best thing, and moreover it not only grows the bone, it grows the surrounding soft tissue. So there is no requirement for the soft tissue graft also. So it works on the histogenesis. So that means building the histological tissues, right? So whenever there is a defect in the bone, we can use distraction osteogenesis. Say suppose small mandible, micrognathia, or in case of severely mandibular retrognathia, that means the mandibular is backward placed, TMJ ankylosis, or in case of craniofacial syndromes like hemifacial, hemi means half, facial means face, microsomia means small mouth. So half of the face is small. So in that case also we can use the distraction osteogenesis. Or in case of Perry-Robin syndrome, if you remember Perry-Robin syndrome, I have taught you in the oral medicine lecture series in the syndromes. So Perry-Robin syndrome, we see that there is a bird face appearance. If you see, this is the maxilla and the mandible is going to be somewhat like this in case of Perry-Robin syndrome. So bird face appearance. If you remember, I told you P means palate, so there is going to be cleft palate. R means retruded, so P palate. cleft palate, R means retruded mandible. So we see the mandible is also retruded, the tongue is also retruded. So in case of Peri-Robin syndrome, if you remember, the tongue is backwardly placed, which we call it the glossoptosis. So there is cleft palate, micrognathia and glossoptosis. And the Treacher-Collins syndrome, guys, if you remember, I told you, if you have watched this movie, which is a wonder movie, in that case the kid is having Treacher-Collins syndrome, which is basically also known as the mandibulofacial dysostosis. That means the mandible is not formed properly, face is also not formed properly. So Treacher-Collins syndrome is also known as the mandibulofacial dysostosis, in which we see the bird or fish face appearance. So there is going to be hypoplasia of the zygoma, mandible, even ear, or there is going to be underdeveloped mandible. So in that case, we are going to regenerate, I must say, regenerate the mandible using the distraction osteogenesis, or in case of Neger syndrome. So in that case, there is also malar hypoplasia or micrognathia. So all these situations where there is hypoplasia of the bone, we can use the distraction osteogenesis to regenerate the bone. So there is a new bone formation. How do we achieve it? By distracting the two fragments of the bone, by separating the bone at a controlled rate. So that way we induce the new bone formation, we induce the histogenesis. So rest all situation like mandibular defect after a tumor, if we have removed the mandible, then also we can use the distraction osteogenesis, or in case of mandibular retrognathia with obstructive sleep apnea, or in case if there is mandibular asymmetry, then also we can use the distraction osteogenesis. So I am going to brief you about the healing so that you know what I am talking about. What happens, say suppose, if there is a break in the continuity of the bone. Say this is a bone and you have done an osteotomy. So if you have prepared an osteotomy, this is a discontinuity. So all the blood vessels, say there are blood vessels like this, get ruptured, right? So there is a accumulation of the blood. So after osteotomy, which is our first step, or you can also go for the corticotomy. So corticotomy, we do it for long bones, wherein we are going to only cut the cortex, we spare the medulla. So first is we prepare a osteotomy, that is a cut in the bone. We are going to make a cut in the bone. So what happens once we make a cut in the bone? There is rupture of blood vessels while we have fractured the bone. So there is a accumulation of the blood. So you will see that the blood start accumulating over here. Then there is a little swelling in this area. So that is going to create a hematoma. When the blood accumulates, it forms the hematoma, which is due to the accumulation of the blood. Now this is the phase of the tissue destruction and the hematoma formation. Now what happens, there are inflammatory cells which comes like macrophages, cytokines, or transforming growth factor or platelet derived growth factor. Now all these mesenchymal cells, they start proliferating and differentiating. So they start proliferating and differentiating into some new cells like fibroblast. First of all, there is new capillary. So let me just write, there is new blood vessels, new capillaries which are formed, which is filled with the new blood. Then there is a meshwork of the granulation tissue. So there is granulation tissue which is formed, which contains of fibroblast and like chondroblast, osteoblast, and this particular condition, not condition, this this is a fibrocartilage callus. So what do we call it? The soft callus, which is formed, or fibrocartilage. Now we want this to happen so that the bone formation occur. So this phase, we don't distract the bone yet. We keep the bone in its position, and this phase is known as the latent period. We are not going to do any movement of the bone until there is a soft callus formation occur. Then the soft callus get thickened, all the cellular mass get thickened, and then the ends become sticky. Then they form the hard callus, bony hard callus. And this is the time that we start distracting the bone using the distraction devices, right? And after few months, this hard callus or bony callus is formed into bone. So then we have the consolidation phase, wherein we are not going to do any movement so that the hard callus is formed. And then when the hard callus is, when the woven bone is converted into the cancellous bone, we call it the remodeling of the bone. When this woven bone is converted into the cancellous bone, right? So this is the mechanism, how this is the normal mechanism of a healing, and that's how the new bone is formed. And with the help of this mechanism, we are utilizing this mechanism to regenerate the new bone formation by distracting the bone fragments at a controlled rate, right? So what are the steps? Let's just write the steps again. So I think we can write it over here also, guys. So let's write the steps one by one. First step we have is the osteotomy preparation. So osteotomy is basically preparing a gap between the two bone fragments, right? We use it very low energy for preparing the osteotomy, and along with that we also use the irrigants so that there is no necrosis of the bone. So if we exceed 47 degrees Celsius for a minute, then there can be chances of necrosis of the bone due to heat of the burr which we are using to prepare the osteotomy. So whenever we are using the burr to make a cut in the bone, we have to be very careful that we are not overheating the bone. So that's the reason we are also using the irrigants, so that the heat is, we are not overheating it, because once we overheat it, there can be thermal necrosis of the bone, the necrosis of the bone due to heat. Since there is a critical temperature of the bone, which is 47 degrees Celsius. So we use irrigants, no overheat, plus we use the irrigants. So then these two bony fragments are stabilized using a fixator. This fixator can be extraoral, intraoral. I have showed you the distraction device. The fixator can be applied within the oral cavity or applied outside the oral cavity. If we are applying inside the oral cavity, then you have to do the surgery again when you want to remove it. So the disadvantage of intraoral is that you have to again go for the surgery in order to remove the distraction device. Second one we have is the latency period. So you are going to stabilize these fragments with the help of fixator also. Using a fixator. It can be, or the distraction device. It can be extraoral, it can be intraoral also. So, next stage is the latency period. So, latency period is the time duration between the osteotomy and the period when we start the distraction osteogenesis. So, it is the time period between the osteotomy and the time when we start distracting the bony fragments. So, we want the hematoma formation to happen so that the soft callus is formed, so that the bone formation happens. Otherwise, what happens if we are going too fast for moving the bony fragments, say suppose if we are keeping the latency period very less, there can be no bone formation, or also if we are making it too fast, then there can be calcification, no callus is formed at all. So, we have to wait till this fibrocartilage callus is formed. So, fibrocallus is formed till the soft tissue callus is formed. So, this waiting period is what do we call the latency period. So, this latency period is different for each age group, because in the children there is more blood supply, more vascular. So, the latency period is less, right. So, in the children the latency period is 1 to 2 days. For adult it is 5 to 7 days, and in general we call it range from 0 to 10 days, right. Then the next one we have is the distraction. So, distraction is the time period when we start distracting the two bony fragments. So, this is the gradual traction of the incremental, I must say, incremental traction of the bone. So, there are two things, one is rate, another one is rhythm. Rate is the amount of distraction which we are doing in single day. So, that means I told you in the custom made distraction device I showed you up here has got 0.5 millimeter of pitch. That means if you make one full turn, it is going to make a distraction of 0.5 millimeters, right. So, that is what do we call the rate, the amount of distraction we are doing in a single day. So, that is known as the rate is the amount of distraction in a day, per day, right. Now, rhythm is the frequency at which you are doing this distraction. Say suppose you are doing it 4 times a day, 2 times a day, like that. So, that is a frequency or the time interval. We are doing it in a day, that is known as the rhythm per day, right. So, the rate is ideally 1 millimeter per day. So, that is given by Elizarov. Everything ideal is given by Elizarov. So, that is the reason we are calling him the father of distraction osteogenesis, but it may range from 0.5 to 2 millimeters, right. One more thing I would like to add is, in children I have told you 1 to 2 days, that is a child of 8-month-old. So, this latency period is allowed before we start the distraction forces, before we start distracting the bony fragments. Usually we take 5 to 7 days of time. In younger patient, like say 4-5 years of age, there is increased bone metabolism. So, that case we can shorten this latency period. So, latency period is reduced in children, but The rate is more in children. So it is more in children. So we can also say that the rate is dependent on the age factor, right? Or it is slow. Say suppose if a person has undergone the radiotherapy. So in that case, in a radiotherapy treated bone, we have to go a little at a slower rate, we can say. So then we have the rhythm. Rhythm is the frequency or the time interval at which we are doing this 1 millimeter per day, right? So this is our rate. Rhythm is the frequency or the time interval at which we are doing this desired rate. How can we do it? We can do this 0.25 millimeter into 4 times a day, right, which is ideal, which is ilizarov. Then we can also do 0.5 millimeter into 2 times a day, which is the one we do it clinically. So we use a slow continuous force, which is the best force, which is works on the stress tension principle, works on the Elizarov principles for a successful distraction osteogenesis. What if we make this rate fast? Then there can be chances of the inferior alveolar nerve damage. So this rhythm is independent of the age. Independent of age. That can be asked as a MCQ. Right. It is more in children, while on the other hand, the latency period is less in the children. Rate is more in the children. We are distracting more, but we cannot go more than 1 millimeter because we can damage the inferior alveolar nerve. So the next phase we have is the consolidation. So guys, latency period is also known as the healing period. While on the other hand, the consolidation phase is known as healing index. So we have the fourth one, which is the consolidation phase. This is also known as the healing index. So now we stop distracting the bone. This is the time between the stoppage of these traction forces and removal of the distraction devices. So let me just write over here the time period between the cessation of the traction forces and the removal of this device, removal of the distraction device. Once we achieve the desired length which we want with the fixator, then we keep it in its place, right? So this time period is known as the consolidation phase because we want this woven bone to calcify. So this time period is at least 3 times more than the distraction times because we want the bone to calcify, guys. We want the bone to get the bony callus. We want this hard callus. So this time is way more than the distraction time. So if you remember, the distraction time is, which is the rate, the rate is 1 millimeter per day. So this consolidation time is when the woven bone is calcifying. So it is more in adults, 8 to 12 weeks. In children it is 6 to 8 weeks. Usually we wait up to 6 weeks of time. Then the last stage we have is the remodeling of the bone. Remodeling of the bone. So this is the time when the bony callus is finally formed into bone. So the time period when the woven bone becomes the cancellous bone, wherein we can apply fully functional forces, right? So wherein the bone is fully formed. So that is the remodeling of the bone. Here in distraction osteogenesis, we are not only lengthening the bone, simultaneously we are lengthening the soft tissue also along with the distracted bone. So that is the reason it is more beneficial over the bone graft, and also there is no donor site morbidity. Also it gives us a stable environment for the regeneration of the bone. So we use this distraction osteogenesis to generate a new condyle. In case of bony ankylosis, so if you remember the Caban's protocol which we have covered in the previous part of the lecture, so in bony ankylosis we use this Caban's protocol, and now after gap arthroplasty recently, instead of going for a rib bone graft, a costochondral bone graft, we go for the distraction osteogenesis. So one more question can be asked is, which is the target cell, the first cell which is associated with the distraction osteogenesis? So that is the endothelial cells, right? Because the new capillaries are formed. Endothelial cells. These are the first target cells. Second target cell being our osteoblast and these osteogenic cells, right? So this is about the distraction osteogenesis. Also we can use it for alveolar ridge reconstruction. Say suppose I have shown you this diagram over here. Say suppose we want to increase the width of the bone here. If you want to place implant but there is not enough alveolar ridge height, so in that case we can regrow the height. We can also use this distraction osteogenesis to apply the vertical height as well as horizontal. So we can increase the bony height for implant also, if you want to go for the dental implant surgery, to increase the alveolar ridge height. We can use the distraction osteogenesis. We can also regrow new condyle with the help of distraction osteogenesis in case of bony ankylosis. So this is about distraction osteogenesis. Hope you have enjoyed the video. If you have enjoyed the video, give it a thumbs up. Also comment in the comment section below how you like the video. If you have understood the whole concept of the distraction osteogenesis, please do comment, because it motivates me to put more free videos for you guys and to make free notes which you can check out on www.extrude.com or link in the description box below. You can also support me on Paytm as well as on PayPal to make free videos for you guys and to make free notes. So till then, keep reading, keep learning, stay motivated. I'll see you soon in the next lecture.